Do you or someone you know experience unrelenting and persistent feelings of anxiety? Despite your best efforts, medication, traditional approaches, perhaps even psychotherapy treatment have proven to be ineffective in alleviating your anxiety. This persistent anxiety may be more complex than it seems. Your anxiety may be linked to shame stress, which is very common among people with narcissistic traits. Without the expertise of a trained therapist who works specifically with personality disorders, this shame stress may go undetected and therefore untreated. All the typical signs of anxiety are the same, but this shame stress manifests in very unique ways, such as there's this fear of being humiliated or ashamed when one isn't showing up at 110% and performing in a way that appears to be perfect. It shows up in your procrastination. And it's hard to get projects started because oftentimes you're trying to people please. In other words, you're very concerned about people perceiving you in a certain way. It shows up in your ruminations. In other words, there's a constant thinking about, should I have said this? Should I have said that? And what does it mean that I did this instead of that? How are people thinking about me? How do they see me? And these thoughts have a pervasive feeling of being inadequate, of being judged, of being incompetent, of feeling broken. And that may prompt you to avoid social situations because you're so anxious about, if I say this, what are they going to see? Are they going to see that I really don't know what I'm talking about? Or how am I going to present myself? What if they don't like me? What if they think I'm incompetent and not capable? Overall, what I'm trying to get at is there's this pervasive sense of inadequacy that leads to a very anxious and stressful state of mind. Now, a big problem here is that when you get anxious, you think you know the reasons why. But unfortunately, these reasons you come up with oftentimes are related to external factors such as, oh, I just didn't have enough sleep, or oh, I have a big load, like I have a lot of work to do, or I just woke up and I was feeling anxious and there was no reason why. So what I'm encouraging all of you to do is look beyond this manifest presentation of the anxiety and think about the underlying causes of it. And one cause, this is what I'm proposing you today, has to do with this shame stress, this feeling of so much fear of being humiliated. And this leads right into why so many of the traditional approaches are not effective, because they don't address the underlying causes of the anxiety. So what is this shame stress all about? Let me answer that by way of a simple example. Picture a fictitious patient who comes in and talks about having a lot of anxiety and almost having a panic attack when on a recent date. He said that they were in a crowded room and he was very concerned that there wasn't enough oxygen and that he was going to suffocate. However, when you listen very closely to the story, that which escalated the anxiety were thoughts about excusing himself to get some air. He did eventually end up excusing himself from the room, and he was able to calm himself down by using some basic techniques that we reviewed in the prior session. However, from the perspective of a psychoanalytic psychotherapist, this is not enough, because this will address the manifest anxiety, but doesn't get to the underlying causes. So what do we do? So when he tells me that he stepped out of the room, he got some air, he felt better, he was ready to tell me about the rest of his week, as if this episode was over. But this is where we want to go a little bit further. And I ask him, can we go back? Can you tell me specifically, when you stepped out of the room, for instance, to get some air, what was going through your mind? And what he began to talk about was this fear that she was going to think that there was something wrong. And when I explored this further, what he began to reveal was that she is going to begin to think that there's something wrong with him. In other words, what kind of guy needs to excuse himself from a date? That he's inadequate, that somehow he's failing, he's not perfect. All the things that I mentioned earlier, all the things that lead up to a fear of being rejected. In other words, there's not going to be a second date. So what we do is we slowly begin to explore, and I help him give voice to all of his fears around shame, humiliation, and rejection. And in turn, as he gets more comfortable and begins to put this into some perspective, in my field, in the field of psychoanalysis, this is what we call reality testing. Then when he's out on a date again, because he could test reality, his anxiety begins to reduce, and we subsequently rarely ever hear about these anxiety or panic attacks or quasi-panic attacks. I hope you could see from this example that the techniques here that are used from a psychodynamic perspective go far beyond breathing, meditation, and relaxation techniques. Now, I want to highlight that those techniques are important to return you from what? A sympathetic to a parasympathetic state, right? Or hyperarousal, right? You're too aroused to a more regulated state of mind. But what I'm encouraging all of you to consider is that may not be enough. You may need to go a little bit further if you want long-term lasting results. Look, we have to stop there for today. But if you're interested in hearing more about the various facets of narcissism and how they're related to anxiety, please be sure to subscribe to this channel. For those of you who want to do a deeper dive into this, I have a podcast on narcissism that goes into far more details. Please feel free to check that out as well. Now, inevitably, these things are complicated, and as always, if I said anything that confused you or you have any questions, please leave a comment below or feel free to reach out to me directly. Okay, bye for now.